This is Rogers TV, Fredericton. We interrupt our regularly scheduled programming in order to bring you the following special presentation.
Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et le Premier ministre Blaine Higgs. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and Premier Blaine Higgs. Dr. Russell.
Thank you. Good afternoon. Bonjour. In the days and weeks ahead, I will have sad news to share with you. It is very likely that I will have to tell you about fellow New Brunswickers who have become seriously ill due to COVID-19. It is very likely that I will have to tell you about the growing number of cases in our province's hospitals. And it is very likely that I will have to report at some point in time that New Brunswickers have died from this disease, which has happened in other jurisdictions in Canada. Au cours des jours ou des semaines à venir, je devrais vous annoncer de tristes nouvelles. Je devrais probablement vous annoncer que l'un de vos concitoyens du Nouveau-Brunswick est gravement malade après avoir contracté la maladie à coronavirus. Et je devrais probablement vous annoncer que des Néo-Brunswickois sont morts de cette maladie, comme dans les autres provinces déjà. How often this happens in the weeks ahead depends on each and every one of you. It is vitally important that all New Brunswickers stay at home to the greatest extent possible and reduce our contact with others to the absolute minimum. Staying home will save lives. Today we have no new cases to report. We stand at 17 confirmed cases in the province, all related to travel outside of Canada or close contacts with an existing case. You may have heard over the weekend that Prince Edward Island released travel information about one of their confirmed cases that may impact New Brunswickers. On March 16th, a woman flew from Toronto to Moncton on WestJet Flight 3456, departing Toronto at 8:35 a.m. and arriving in Moncton at 12:05 p.m. All passengers on that flight are being asked to self-isolate. Le fait de demeurer à la maison permettra de sauver des vies. Il n'y a aucun nouveau cas à signaler au Nouveau-Brunswick aujourd'hui. Nous comptons maintenant 17 cas confirmés au Nouveau-Brunswick et tous sont liés à des voyages à l'extérieur du Canada ou en contact avec un cas existant. Le gouvernement de l'île du Prince-Édouard a récemment publié des renseignements sur un voyage effectué par un cas confirmé dans cette province qui pourrait avoir des répercussions sur des Néo-Brunswickois. Le 17 mai, la personne en question était à bord d'un vol 3456 de WestJet qui a quitté Toronto à 8h35 le matin et a atterri à 12h05 l'après-midi à Moncton. Tous les passagers de ce vol sont appelés et s'auto-isolés. The recommendations that I have made and the actions taken by the government in declaring a state of emergency are absolutely necessary for the protection of our fellow New Brunswickers. Today, I offer my profound thanks to every New Brunswicker who has taken these directions to heart. To those who have closed their businesses and suffered financial losses and uncertainty as a result, I say thank you. To everyone who has taken a few extra minutes to thoroughly wash their hands several times a day, I say thank you. Je tiens à remercier du fond du cœur chaque parent qui s'est protégé et qui a protégé les membres de sa famille en restant à la maison. Ne courant ainsi pas le risque de s'exposer de ce virus. Cette situation est difficile pour tous, je suis consciente. And to every parent who has kept themselves and their family members safe at home, I say thank you from the bottom of my heart. That is hard, I know that. As a mother of 2 teens and many other parents who have had to have difficult conversations as a family, in these challenging times there are new realities. It is difficult, stressful, and it can be heartbreaking. As a parent, we need to provide leadership to our families and we need to stay safe. I also have friends and colleagues working in the healthcare system who have taken steps to be away from family in order to protect them. These hardships we are facing in this crisis are difficult. These brave men and women who continue to go to work every day to keep us safe and prepare for the COVID-19 cases that are sure to come. We have to protect them so they can carry on with this important work. When we take actions to limit the spread of this disease, among those we are protecting are the frontline workers. So they stay at home and practice social distancing. You are not only protecting yourselves, you are protecting the people who may soon be saving your life. We are all working to support our healthcare workers and essential workers and critical structure workers. We have taken steps to improve the efficiency of our testing processes, and the laboratory at the Georges Dumont Hospital in Moncton is now able to give final confirmation of any COVID-19 test done in New Brunswick without sending tests to the National Laboratory in Winnipeg. This will speed up the testing and confirmation process here in New Brunswick. Nous déployons tous des efforts pour appuyer nos travailleurs du secteur du soin et de santé et je tiens aujourd'hui à vous faire part de mesures que nous avons prises pour accroître l'efficacité de nos processus en matière de tests de dépistage. Le laboratoire de l'hôpital du Georges Dumont à Moncton est maintenant en mesure de confirmer de façon définitive tout test effectué au Nouveau-Brunswick sans devoir envoyer les analyses au laboratoire national à Winnipeg. Il sera ainsi possible d'effectuer les tests et d'en confirmer les résultats plus rapidement au Nouveau-Brunswick. Thank you very much. Merci.
Good afternoon. Bonjour. I want to thank everyone who continues to listen to Dr. Russell and her team at Public Health. It is important that we take public health recommendations very seriously. Only by doing this will we be able to limit the spread of COVID-19. And while the last few days of no new cases being reported is encouraging, I think the message that Dr. Russell is telling us that we are really just beginning into the phase that we can look in the future and say we must control our access, we must control our exposure because we know that the situation can easily worsen and is likely to do so. Around us, some provinces have made decisions to close their borders. Autour de nous, certaines provinces ont pris les décisions difficiles de fermer leurs frontières. As you are aware, New Brunswick has numerous border crossings to consider. We share borders with Quebec, Nova Scotia, Prince Edward Island, and the state of Maine. We already, together with the federal government, exerted the necessary precautions at our Maine-New Brunswick border. I'm pleased to note the U.S. border crossings into New Brunswick are down 90%. We must make sure that we do this correctly and that we have a plan in place when we do, and we are working on that today. Nous devons nous assurer de procéder correctement. Nous devons aussi avoir un plan, et nous travaillons à la préparation de ce plan. The same is true about everything we are doing in relation to COVID-19. We know many New Brunswick businesses and individuals are being impacted financially, and we're looking at ways our government can assist the federal government in mitigating some of the impact. We understand people continue to have questions and concerns about COVID-19, including questions about compliance and how to access help if you need it. Your first stop should always be the Government of New Brunswick website dedicated to COVID-19. Comme première étape, vous devriez toujours consulter le site web du gouvernement sur le COVID-19. If the information you are looking for is not available on the website, a toll-free number and an email have been set up to assist you. The number is 1-844-462-8387. It is bilingual and currently operating 7 days a week from 8:30 a.m. to 4:30 p.m. The email address is helpaid@gnb.ca. If you have concerns about a workplace that is not safe, please continue to contact WorkSafe New Brunswick directly. The Department of Public Safety has been checking businesses across the province to ensure they are complying with recommendations from Public Health. Of the 762 businesses they have checked so far, only 43 were not complying. This is a compliance rate of 94%. While 94% is good, our target is 100%. I want to thank the businesses that are complying and putting the health and safety of their employees, customers, and New Brunswickers first. No one wants to make this law an enforcement matter with charges and fines, but we are ready to do so. And if that's what's needed for compliance, we will act. Personne ne veut que cela devienne une affaire d'application de la loi avec des accusations et des amendes. Mais nous sommes prêts à le faire. si cela est nécessaire pour nous assurer que tout le monde respecte la loi. We are not asking you to do this lightly. We know it impacts your businesses. But it is imperative that non-essential businesses comply if we are going to flatten the curve. We know we have looked at different businesses and how they can stay moving and how we can keep our economy rolling in a safe and effective manner. And that means that each one of them has to respect the social distancing, the physical distancing within the workplace. It means that every business has to comply with the orders of public health. It isn't just businesses who must comply with mandatory social distances. We must all do so as well. I believe that by working together, we can save lives in this province. Si nous travaillons ensemble, je pense que nous pouvons sauver des vies dans notre province. I'm telling you this not just as a premier, but as a son, a husband, a father, and a grandfather. I understand that you are concerned about your families and how this virus will impact all aspects of our lives. I too am concerned, but I understand what is at risk, and because I have an elderly mother, a wonderful wife, beautiful daughters, and grandchildren I adore, we must all together face the challenge and obey the rules and minimize the impact on each other. The decisions I am making, along with my colleagues on the all-party committee, are designed to keep all New Brunswickers safe. We need you to help us keep our province healthy and safe. We need you to continue to follow recommendations from public health. We need you to continue to stay at home when possible and to keep a physical distance between yourself and others when you have to go out. We need you not to go to the grocery store as a family, but to instead designate one person to shop for essential items while the others stay home. We need those of you who have to go to work to continue to do so, but we also need you to go directly home afterwards. We need you to find ways to continue to distance yourself physically while staying connected through social media, phone calls, or simply waving to neighbors from your home. What we're asking of you isn't easy, but it is necessary. Together, we will get through these challenging times. I am encouraged when people call or make suggestions. I'm encouraged by the many comments that I'm getting through this process, but we're always looking for advice. We're always looking for better ways to communicate. And we're always looking for comments about how we can deliver as a society better results at the end of the day. I want to say thank you to the many colleagues that are working not here in this building to help us communicate to each and every one of you every day, but the many people that are working in institutions, our hospitals, our nursing homes, and keeping businesses running so our economy can stay as normal as possible through this crisis, while at all times ensuring that the public health rules are followed. We have a lot of great people in our province, and I want to keep each and every one of them safe and healthy and happy. Thank you.
Thank you, Dr. Russell and Premier Higgs. We'll now proceed with questions from the media. Nous allons maintenant procéder aux questions des journalistes. Each reporter will have one question and one follow-up. Chaque journaliste aura une question et un suivi. Starting off, we'll go to Vicky Hogarth, Charlotte County TV.
Thanks, Dave. My first question is for the Premier. Residents of Campbell Island are still able to buy essentials in Maine, but is it really safe at this point to expose Campbell's residents to a different country's safety measures just for groceries, or should an alternative link to the rest of New Brunswick be put in place immediately?
Well, the residents on Campbell Island have two choices. They don't need to buy locally in Lubec or just across the border. They have a transit capability to go right through to St. Stephen. So we have secured that with the federal government, so those residents can go right through Maine and into St. Stephen. So they have a choice in that regard. I think your point is valid in relation to should they be allowed to go to the store in Lubec or not. At this time, I guess we are allowing that to happen. That may change going forward, but certainly they have that option at this stage.
And did you have a follow-up, Vicky?
Yes, it's also for the Premier. Are there discussions about repurposing schools to respond to COVID-19 at this point, be it for patient use or to give social spacing to residents in shelters?
So I guess any facility such as schools, or I guess you could say hotels that are not operating or certainly not operating to full capacity that could be shut down, and utilized for other purposes, could be available in the future. We're hoping, obviously, to manage this process through the isolation that we are saying is mandatory, must be mandatory. There's surveillance that we're putting out there to ensure that businesses comply with the distancing practices and ones that are operating. We will look at all options for security and isolation as needed. And that goes within our hospitals as well, how we isolate cases within hospitals or particular hospitals, and Department of Health and Public Health are working on those options. So anything could be possible. At this time, our goal is to mitigate exposure, to ensure that we can actually find solutions within our current health structure, but knowing all the while that these options exist should they become necessary.
Thank you. Michel Corriveau, Radio-Canada.
Bonjour, j'ai une question pour Dr. Russell. J'aimerais savoir, Mme Russell, compte tenu du fait que 3 autres provinces de l'Atlantique demandent aux gens qui ont visité d'autres provinces de s'isoler 14 jours, est-ce que c'est une bonne idée, à votre avis, pour limiter la pandémie?
Alors, c'est une bonne question, Michel. J'ai discuté avec mon équipe au courant de la fin de semaine et aussi avec nos collègues dans les autres provinces. Alors, on aura plus d'informations pour partager demain sur ce sujet.
Tu as suivi, Michel?
Oui, j'ai une question qui peut s'adresser soit à Mme... en fait, c'est pour M. Higgs plus. Est-ce qu'au Québec et en Ontario, on veut... au Québec, on vient d'annoncer, et en Ontario, la fermeture de toutes les entreprises et les commerces qui ne sont pas essentiels, et on inclut les grandes entreprises, la construction et tout ça. Pourquoi on ne fait pas la même chose au Nouveau-Brunswick?
So, Michelle, you're asking about construction in the province and on English?
Yeah, Quebec is asking to close all industries that are not essential, and it includes construction and
Yes.
big aluminum producers, big industries. So why are we not doing the same?
So at this point, Michelle, I think it's important. What we're trying to do is a balance here that we can have workers go safely in some activities to keep our economy moving. We may get to the point where everything gets shut down. Right now, companies are respecting our public health requirements. That's why we're doing the monitoring and surveillance in the different communities. That's why we did over 700 over the weekend, to understand, are we following the rules? It's going to be very important that businesses are following the rules. It's also going to be very important that people are respecting the isolation. And certainly we want to know if people are not responding to their isolation requirements, that's a concern for every one of us. It's a risk to every one of us, and it's not optional. So we may get there, and we're having a call tonight with the Prime Minister and all my colleagues across the country as we discuss kind of the economic impacts, the health impacts, and can we balance both?
Merci, Michel. Kevin Bissett, Canadian Press.
Mr. Premier, you just mentioned about your meeting tonight or your call with the Prime Minister. What do you want to hear from the Prime Minister tonight, and what do you want him to hear from you?
Well, I think certainly there's two main points. One is the consistency across the country in terms of rules and regulations that we're all putting forward. I think we can get some harmony in that regard. The cross-border issues, rather than one province at a time shutting down their borders, I mean, we were very focused on the U.S.-Canada operation and certainly with us with Maine. I'd like to get a standardization there on what we should be imposing one border to another interprovincially. Also economically, understanding the package. We've gone through a lot of the aspects now of the financial package. We do understand probably the most of it in terms of the benefits. There are gaps that have been identified, and we'll be discussing those tonight with the PM as well.
Did you have a follow-up, Kevin?
I do, and Mr. Premier, you heard yesterday from your colleague in Nova Scotia certainly some of the moves that they're making to enforce the self-isolation and social distancing. Some fines of fairly hefty amounts of $1,000 and $7,500. Are you looking at the same kind of things for New Brunswick?
Well, certainly, and as I mentioned earlier, we did this weekend the surveillance to understand what people were doing and if they're following the rules. And I said we've got a 90% compliance. Our goal is 100%. We will enforce those rules. We'll enforce them through fines and penalties as required. But absolutely, these are not optional. These aren't recommendations. These are requirements, and we expect them to be adhered to.
And have you settled on the amounts for those fines?
There's varying degrees depending on the infraction and depending on the risk. I mean, depends if it's a business or it's an individual, if we're going to get into individuals. But if individuals cannot take responsibility for themselves and they are exposing a health risk to others, there's an obligation not only to them, but there's an obligation for us in government. And so the penalties can range. I think, in a business, I'm not going to throw a number at it, but it certainly could be in the thousands.
Thanks, Kevin. Sébastien Lachance, l'Acadie Nouvelle.
Yeah, my question is for Premier. Good afternoon, Mr. Hicks. As you know, many New Brunswickers are now unemployed. According to a lot of social and community groups, a lot of them will have difficulty with paying their rent, their mortgage, and their bills at the end of the month, so in just 1 week. Is there any special measure planned to help these people?
Yes, indeed. Certainly, we've analyzed the federal package and what it means to individuals. I mean, the EI benefit is available immediately without delay. The other package, social assistance packages to keep them operational, the mortgages, the MB Power rates, are all banks and MB Power. We've all moved out the requirements in that regard. The same goes for the taxes. We've asked for different changes in the remittances that are being suggested to government, but like the EI and CPP and things like that, so businesses could keep people employed longer or they can afford to pay them. We are looking, and we want to understand every individual case. We've set up different lines of communication, whether it be through WorkSafe, whether it be through our new information line, so people can get in contact with government. We don't want to use a telehealth. We don't want to use 811 or 911 for these matters. We want to use an information process that they can get directly into government without tying up the health concerns. So we have a number of proactive measures in place so we can hear firsthand of an individual's concern, their situation, and react quickly to it.
Est-ce que tu as un suivi, Sébastien?
No.
Merci. Elizabeth Fraser, CBC.
Hi there. My question is for the Premier. Can you just elaborate for me what happened to those businesses in violation, businesses who didn't follow government's orders to close? So will there be a fine? Will they be checked on again today at some point?
They will absolutely be checked on again today. And the next phase would be a warning on what's required. Either they have to shut down or they have to change their practices depending on the business. And then subsequently it would be a fine or closure. We will not allow them to continue in violation.
Do you have a follow-up, Elizabeth?
Well, I'm just wondering what businesses, what kinds of businesses are we talking about here?
Well, I think that, in some cases, many people, and I'll just use an example of would claim to be a retail business, and maybe they have a pop machine and chips, and then the rest of it doesn't comply. So that's not exactly a retail or grocery store, convenience store. So some people have taken liberty with the definition, and I understand, it's a big impact to a company, but if that business is in violation of the Public Health Act, is in violation of our requirements as a business that can need or continue to run, it will close. We will be closing it.
And I do have another question. Where does New Brunswick stand today in possibly following Nova Scotia and PEI and forcing anyone who enters the province to self-isolate for 14 days, even if they've just come from a neighboring province?
So we are already doing that with our main point of entry, I guess, certainly from the U.S. That was our concern, is our people coming back, particularly maybe from southern winter vacations and now coming in. But as I was pleased to report today that 90% reduction in the cross-border that way. Tonight it'll be a topic with the Prime Minister in relation to what other provinces are doing. I think it is something that I had talked to Premier Stephen McNeil last week, and I subsequently talked to Dennis King following their change. And I can see that happening here. I am looking to get some alignment across the country, but it doesn't matter.
Okay, but
We will
right
do our own
now,
thing.
if I were to be coming back from Prince Edward Island back to my home in New Brunswick, would I have to self-isolate for 14 days?
No, you wouldn't. But
No, I would not.
tomorrow that could change. Thank you. Laura Brown, CTV.
Hi, Premier. I'm wondering at one point, or is it the RCMP and local police forces that you're asking to check on these businesses and potentially be in charge of finding them? And at what point are they allowed to start finding businesses?
So it could be a combination, but we're primarily focused on public safety officers that would be looking at health standards, and because it's that's the violation we're talking about, our primary health standards and in compliance with the state of emergency.
Thanks. Laura, do you have a follow-up?
Okay, yeah. This one's a bit long-winded. There are a lot of parents upset and confused about the child care system right now. Some are being charged for the service bill in order to keep their spot, but others say their child care center chose to lay off its employees, and so those parents don't have to pay. Now, I understand the province is willing to help those parents who are laid off during this time, but several have expressed to me that they don't feel the situation right now is fair. Now, I have looked on Twitter. The education minister has been clear on Twitter. There are no changes coming to this policy, according to him. He says if government helps all parents out with this, or helps child care operators, I guess, then that means everyone pays, despite many people not being parents. But you've already expressed your willingness in this call to help those who potentially are coming up against it with rent, et cetera, small businesses or industries through this. Are you considering changes to the policy regarding helping parents with child care?
So I think the focus here is that individuals do not suffer a financial penalty in relation to the situation we're in. We're trying to help those that have the greatest need. So if the situation is that and we need to, I don't want to get into the specific details of different daycares, but if a daycare operator, their let's say the children are not there any longer, or they've gone and the daycare operators laid off their employees, then those employees need to be looked after because they're home now without an income. If someone else is home and they're concerned about paying a daycare operator who's still paying employees, but they're at home now and they have their salary hasn't been impacted, I think we have to consider the priorities here. And my priority would be someone who has lost their income and they're now at home wondering how they're going to pay the power bills or feed their kids or pay for the groceries. And that'll be where the priority is. And I think generally, New Brunswick would understand that this isn't about, this is not an exercise of anyone, having a higher level of income because of it or having less expenses. It's to ensure that every New Brunswicker can survive this. And we can provide the resources necessary to ensure they have food and water and their kids are, and finances, so that their kids are being looked after as much as anyone else's children. We're looking at each case and in this perspective, but I mean it's a case of ensuring that everyone can survive through this health crisis.
Thank you. Mike Angus from Media Q. Mia Urquhart from CBC.
Thank you. My questions are for the Premier. Now that the Education Department has had some time to consider options, what is the government planning in order to continue educating students at home?
So I can't provide details of what's being planned, but I do know in speaking with the minister and with the deputy ministers that they are now working with teachers to understand what can they provide for online services. How do they ramp that up, given the uncertainty of when we could possibly be back in the school, if at all, for this season? And I would dare say the minister will come forward with details in that regard. But we are looking at online programs. We are looking at what can be achieved to continue the education, to salvage what we can from this year. But it's early for me to speculate what that might look like.
Do you have a follow-up, Mia?
I do. We've talked to parents who are stressed about how to keep their children from falling behind academically. What would you say to them about what's expected of them?
What's expected right now is for them to keep their kids away from harm's way in relation to their health. And so to obey the rules of public health, to ensure that the isolation criteria is practiced, to ensure that the social distancing is practiced, their number one priority has to be the health of their children and their family. And that could be an extended family and how they can help others that have an inability to help themselves or are themselves being isolated. So that has to be job one. So let's not, I guess, confuse it with anything else. Job two would be how can we salvage what we can from the education going forward and as much as possible online education. And we'll do that. Right now, our focus is totally on being able to manage this wave, to flatten the curve, and have our healthcare system be able to manage it within what our capabilities are. And we can't lose sight of that.
Would you tell them not to stress so much about the academics?
Look, if they are financially able, if they have ability to provide their essential needs, and their kids are healthy, they should feel very comfortable with that the basic needs are being met, and that is exactly what we're trying to achieve at this point in time.
Thank you. Stephanie Sirwa, CHSJ.
Yes, hi. This question is for Premier Hicks. So, the right to evict under non-payment of rent was suspended until May 31st. I'm wondering, does that mean renters who cannot pay their rent due to COVID-19 related issues, do they have to pay all owed rent before that date to keep their place, or are there going to be payment plans in place for them? Or what's going to happen to them?
We gave us that timeline in this stage, not knowing kind of where we're going to be by the end of May. But our goal is that no one gets evicted through the risk or impact that they've experienced from the COVID-19 crisis.
Do you have a follow-up, Stephanie?
I do, yes, thank you. Now, there are many low-wage or minimum wage workers who pay about 50% of their income towards living costs, such as rent or mortgage. And right now, EI only seems to cover about 55% of that income, and some aren't eligible for those due to their hours accumulated. Are there any plans to boost that number?
Yes, there will be, and that's part of the federal package, and it's part of understanding the gaps that we have and how we manage that. So we are looking at that again with the overview that no one gets to let's say be forced into a different situation than they were prior to this health outbreak, this crisis, pandemic, and that we can manage this successfully through this.
Thank you. Silas Brown, Global News.
Yeah, hi, Premier. From what you said earlier, it sounds like you're waiting for the federal government to take the lead in terms of closing the provincial border. Would there be anything that would push you to kind of take the step that Nova Scotia has and host people at the border like they have, or are you going to wait for the federal government at this point?
Well, I think the point that I want to make very clear is that I'm not waiting for the federal government to do anything that I feel is absolutely necessary at this point in time. I haven't to this point, and I won't going forward. However, I want to know that whatever we put in place at the borders is actually effective. I feel that that's happening at the Maine-New Brunswick border. But if I have a police car sitting at the Quebec-New Brunswick border, and what are they going to do? What assessment are they going to make on individuals crossing the border? And how do we follow up to ensure that they come through and you say, okay, you've got to go self-isolate? How do we manage that, record that? Is it RCMP or is it public health? So I think if we're putting a procedure in place, I want to know the procedure is actually going to have an impact. It's not for visual, it's for impact. Everything we're doing here is to ensure that citizens pay attention and they isolate themselves. They don't, cross-contaminate the general population. And when we do a border change, it will have impact.
Thanks. Follow-up, Silas?
Yeah. Further to this idea of limiting interprovincial travel. Will the province also follow the lead of Nova Scotia and now PEI today and broaden the requirements for people to get tested to allow people who have been traveling within the province, within the country rather, and in between provinces to get tested, along with people who are returning from internationally?
So I will comment on that. Dr. Russell may want to add to this as well. Currently, we are keeping pace with any reported cases. So anyone calling in 811 that has symptoms and needs to be tested, we have now the capabilities at Dumont, and as Dr. Russell pointed out, this testing can be completed here without being sent sent out to Manitoba. The idea of there's our 811 got behind a bit initially, but we're catching up on that now because of our new capabilities. So then the next model from that is in increasing the potential at Dumont, so that we actually can test more cases or more suspects or more that are let's say vulnerable or they're high risk as we go forward. But right now, our goal is to get fully compliant with all of the reported symptom cases that are being coming in through 811 and any other categories that public health has found as they have had known, let's say, cases that we've identified thus far, and they've had association with others who then will be tested simply because we know they've had association. And then you move forward to the next phase of someone who thinks they've had association and where you go. But we want to deal with known commodities at this phase, at this point in time. Dr. Russell, do you have anything you want to add to that?
So just to echo what the Premier is saying, so the discussions are ongoing right now around what the next steps will be around the borders interprovincially and what that will mean for the case definition in terms of who gets tested and expanding that to include people who have traveled not only outside of Canada, but people who have traveled outside of New Brunswick. But those decisions will be made in the next day, and we'll keep you posted.
Thank you. Tom Bateman, Times and Transcript.
Oh, hi there. For Dr. Russell, first of all, I'm just wondering if you can describe exactly what changed to allow the Dumont to now give final confirmation of a positive case, and then maybe to describe how much time this will save between the time a test is taken and the time those results are confirmed.
So there's a validation process that has to take place over the course of so many number of tests. So that validation has now been complete. And what it will mean is that as soon as the George Dumont has their test results, which will be within 24 to 48 hours of testing a patient, we'll have the results as opposed, and it will be a confirmatory result. It'll be a confirmed result. So we don't have to wait the extra day or so after that for the confirmatory testing to come back.
Did you have a follow-up, Tom?
All right. Yeah, thanks. I've got one for Premier Higgs. We've heard a lot about businesses and their compliance, non-compliance. I wonder about other parts of the state of emergency protocol and how they're being followed. We heard a report today about police having to intervene on a wedding in the southeastern part of the province over the weekend. Have you heard of any other kinds of breaches of the state of emergency protocol? And how would you just evaluate those types of protocol in terms of their compliance?
Well, I have heard of other breaches, and it was a case where an individual was asked to come to work when they had exposure to someone who had been out of province, a traveler who was in isolation, and they themselves said that, no, I can't come to work. So there was some discrepancy there, and it got solved, and the person did not go into work. I think that as we learn, I hope that there's been some confusion around what's compliant and what's not. I think we're asking through our information line that I've identified today. We want to clear up any of that confusion. If anyone's in doubt, call that number. If anyone, is concerned about compliance or they see non-compliance, I think we need to have everybody thinking about how can we deliver the results we want, and that is to maintain this outbreak at a level that we can manage it within our healthcare system. So. Any situation, it's disappointing. I know that I think in terms of funerals, the wakes are not being held. They're either held online or they've been postponed. So I think we're seeing businesses react all over the province, and I'm asking individuals to be part of that. And I know that if you're, 25 and under and 30 and under, you don't think it's a big issue. We can all get together. So then I would ask those, the 30 and under or so, I'd say, look. When you go home at night, whether it be your parents, your grandparents, or someone that you've been with all day that have grandparents or parents, think about them. Think about the impact that you can have. If it's not a big risk to you feel, which it could be, but the stats would say that not so much. It's a big risk to older people, and you need to be part of that to protect vulnerable generations or individuals.
Thank you. Jordan Gill, CBC.
Yes, this question's for Dr. Is there any update on how many ALC patients have been moved from hospitals into nursing homes, and do you have an exact number of how many have so far?
My understanding is that number is 50.
Okay. I guess a follow-up question would be to Premier Higgs. Just want to know if this lasts as long as people expect it may last and schools are not able to resume before the regularly scheduled summer break. What's going to happen? Are teachers going to be laid off? If not, what's expected? What are they expected to do during that time when there is no actual school in session? And if these measures do extend into May or the regular summer break, will teachers have to teach over the summer months?
Well, I would look to the Department of Education and the leaders within education, and that includes the teachers as well, to look at how they can salvage the school year for their students. And I would look for recommendations to come forward in that regard. So I know it's an unknown right now, and I know the curriculum would change as the delays continue. The more we can cover, online for education and set that up, the better I think we'll be. But I guess I feel that we have a very responsible group within our education system, and they will figure out how best to be able to maintain the school year, if at all possible, and in just exactly what that means for the longer that it lags on.
Thank you. Savannah Owen, Telegraph Journal.
Hi, my question is for Dr. Russell. The new online assessment tool doesn't direct people to continue for testing unless they have traveled recently or been in contact with a sick traveler. So I'm wondering if you could tell us what criteria a person would have to meet to get a COVID-19 test at the moment.
So that is what you just said, is what's on the self-assessment tool. But again, it doesn't preclude somebody from calling 811 if they really need more information. So the self-assessment tool is really a good baseline place to get information and direct you. And then if you still are not certain, you can call 811.
So just to be clear, the two on the online assessment tool are the only categories being tested, or because, sorry, the Premier had just said people with symptoms were also being tested. So, sorry, could you just elaborate on that maybe?
So if you have symptoms and you have traveled outside of Canada, that's the criteria right now. We are looking at changing that depending on what happens with the situation around interprovincial borders. So that information will be coming in the next day.
So symptoms but no travel means no test right now, basically?
As of right now, but again, we do have some parts of our teams working at the provincial level and at the regional level, working on what to do moving forward around looking for cases in the community, because this is all about community transmission at this point. Right now, we still only have known travel-related cases and the contacts of those travel-related cases. We do expect to see more of that, but what we're seeing in other jurisdictions is that there's a percentage of community transmission cases where the case can't be traced back to a travel-related case. So when we start ramping up even more of our testing, we will be expanding the parameters around that for that reason.
Thank you. Adam Hurist, Brunswick News.
Thank you. Premier Higgs, as you said, you speak with the Prime Minister and other premiers this evening. I wanted to know, are you in favor of the federal government triggering the Emergencies Act, which is effectively the old War Measures Act?
Yes, I am.
Did you have a follow-up, Adam?
Yeah, so should they do that immediately? And then further, I just wanted some information about the call-in line where people could report members of the public not following the province's state of emergency rules. Is that in place? What's the number? How does it work?
Yes, it is in place, and I did mention it today, so I don't have it right in front of me, but we can send that to you. And it's in place for, as I said, for take load off the healthcare system, for information on compliance, and for non-compliance issues as well.
Can you just elaborate on the Emergencies Act and why that's needed?
Well, I think we need standards across the country. I think that we need to have a consistency here, and I know some provinces are in let's say further along than we are, and that we ever hope to be in relation to the contamination that we've seen in the cases they have. But we can't be complacent in any regard. So I think rather than any of us being in a position that we are kind of deciding on our own what we need to do. I think the consistency across the country is important. I think it solidifies the from one province to another. It helps with any sort of cross-border issues, but it starts to unify our approach as a nation. And I do have a number here, Adam.
Great.
It's 1-844-462-8387.
Thank you.
That concludes today's update. Thank you, everyone. Voilà la fin de cette mise à jour. Bon, merci tout le monde.
Length of the preceding program, we now join the regularly scheduled program already in progress.
Times, which is they don't like big companies. They prefer small and medium size, but that means you're also you're committing to some kind of business poverty for the long run, as opposed to finding champions who are going to be global successes. If you go around the rest of the world, they're going after the global champions. They're not trying to keep just small and medium. So there's a mindset there. Do you want your businesses to succeed or not?
Now, worldwide, the way business has operated is changing. Can you talk a bit about digitalization, why companies feel this may forever harm their business models?
Well, I'm not sure I've ever heard a company saying that digitization would harm their business model. What they worry about quite often is, can they afford it? Because the setup costs me quite high. But digitalization and bringing in Industry 4.0 is a way of increasing your productivity. It's a way of increasing the reach you can have in your markets, because you can do things differently. You can figure out your production processes much better in terms of if you had a problem with one run, you don't have